Hi, this is Dr. Rudhra from Department of Periodontics. I'm an assistant professor. So my topic of discussion today is on periodontal regeneration. So what is this regeneration? It is a reconstruction of the lost part. So in this topic, we'll discuss about the definition and historical aspects of regenerative therapies. We'll also discuss about the biology and rationale and why this regenerative concepts evolved into the dentistry, and what are the indications, innovative materials which is used for the regenerative therapies, and we'll also discuss about the techniques used in periodontal regeneration. So coming into the context, so the basis of periodontal healing involves the two process, which is the repair and regeneration. So coming to what is repair? Repair is just a type of healing where one tissue is replaced by another tissue. So this is a process where we are getting only scar tissue. This does not involve any functional activity of the periodontium. So in order to achieve these functional activity, we need the regenerative process to happen. What is this regeneration? Regeneration is the growth and differentiation of new cells into new tissue. So this is the basic, that is we are accumulating new cells and collecting the new cells so that it differentiates and produces a new tissue. So this is happening via the mitotic activity of the required cells in a more organized way. So those cells which is activating and involved in regenerative process are cementoblast, fibroblast and osteoblast. So this is where we are getting the new periodontal structures and retaining the attachment apparatus of the tooth. So this is very important in periodontal treatment protocols. We have to regain the attachment apparatus of the tooth, that is achieved only via this periodontal regenerative process. So it is an selective repopulation of cells in a more organized way for regeneration to happen. So this is the basics of or introductory part for periodontal regeneration. So how can you achieve this periodontal regeneration? So we have various therapies in periodontal treatment protocol. So one such therapy is the guided tissue regeneration or guided bone regeneration. So in this therapy, we use various materials like membranes and additives. So the additives which is used in these regenerative protocols are enamel matrix derivative, bone grafts, growth factors and various stem cell based therapies and genetic therapies. So in this, membrane plays a major role in guided tissue regeneration. So this is the material which is guiding the cells in such a way that we are gaining the lost periodontium. So this is the basic materials which is used in periodontal regeneration. We have membranes alone or use of grafts alone, and the main achieving the increased innovation in achieving the complete regeneration is achieved via the hybrid protocol, which is the combination of different materials. So those involves the combination of graft plus membranes and use of other biological into the lost periodontium in order to regain the complete attachment apparatus. So coming to the definition of the guided tissue regeneration, these definitions are given by the standard workshops and journals. So the definition given which is in 1996 by World Workshop in Periodontics are, it is a procedure attempting to regenerate the lost periodontal structures by selective cell repopulation or through differential tissue response. And the definition given by American Academy of Periodontology is the procedure wherein regeneration of lost periodontal structures is sought by a selective cell repopulation of the periodontal tissue wound. So in both the definition, we have to understand the concept of selective cell repopulation. So it states that we have to recruit the cells in such a way, in a more organized way, for gaining the lost periodontal structures. Here we have to regain the periodontal structures such as cementum, bone, periodontal ligament fibers and finally the soft tissue maturation. We have to prevent the epithelial inclusion in such a way that these periodontal regeneration or attachment apparatus is regained. So that is the concept of selective cell repopulation. We are recruiting the periodontal ligament cells, which is followed by the epithelial cells. So coming to the historical aspects, so how does the concept of regeneration started? So it started from 1970. So this concept was first given the this idea of emerging regeneration concept was first emerged in 1970 as retardation of epithelial migration. What is retardation of epithelial migration? If the epithelium comes into the healing area, then the healing occurs by a reparative process which is not essential for the functional activity of the periodontium. So repair is just a fibrous type of maturation which is not needed. So we need regeneration, we need attachment apparatus. For that to happen, we should exclude the epithelium from the healing area. So if we exclude the epithelium from the healing area, there will be more mitotic activity of the progenitor cells, which is gained from the clot activity as discussed earlier in the healing phase. So from the clot we will get the progenitor cells and we will get the required periodontal ligament cells rather than the epithelial cells, which is going to give a reparative process. So that needs to be retarded or inhibited. So this concept was first emerged in 1970. And followed by this 1980, a standard rationale and biology of GTR has been emerged, which is called as guided tissue regeneration principle in 1980. And followed this from 1992 till now, we are exploring n number of materials and various roles of materials which is used in guided tissue regeneration, and how they are giving the new periodontal structures is analyzed via various histological and histomorphometric studies. How does this periodontal regeneration came into the role? So this was first derived by the classic studies of Nyman, Linde, Caring and Gottlob. So these are the people who gave the assumption of what cells are needed for periodontal regeneration. So those cells are mainly periodontal ligament cells and perivascular cells. So those are the cells which are needed for this bone regeneration or periodontium regeneration, for regaining the functional activity of the tooth, which is the attachment apparatus. So how can you achieve this goal? What is the goal of this periodontal regeneration when you use a regenerative therapy? The goal is to reconstruct the complete periodontium in the form of well organized and well constructed periodontal ligament fibers, which will be attached between the newly formed bone and newly formed cementum. So as in anatomy, periodontal anatomy, we know the periodontal ligament fibers, the collagen fibers is attached between the bone and the cementum. So this will be lost during the periodontal disease process. In order to regain or re-achieve that, we need periodontal regeneration. For this to happen, we need new formed bone, new formed cementum and also the newly formed periodontal ligament fibers. So this is where the regeneration or reconstruction will happen. So this is called regenerative therapy. So as depicted in the picture, the first picture will denote how this graft and membrane will be placed. So that is shaded in the pink. So if we place a membrane or graft or any other additives in the defect area, two processes will happen. One is the proliferation phase and one is the maturation phase, as we discussed in the healing phases. So in the proliferation phase, there will be proliferation of progenitor cells into the needed cell. So those needed cells are cementoblast, fibroblast, osteoblast and epithelial cells. So when these cells are formed with the separation of epithelial cells away from the defect area, and with the help of fibroblast, cementoblast and osteoblast, we are regaining the collagen fibers and blood vessels. So when this occurs in the proliferative phase, in the maturation phase, as depicted in the last picture, we are having the well organized structure of periodontal ligament. So well organized structure of periodontal ligament fibers are formed. As depicted, the fibers will be arranged in a more organized way of oblique type or perpendicular type of fibers between the newly formed cementum and newly formed bone, which is gained from the cementoblast and osteoblast. So this is the goal we are going to achieve during the periodontal regenerative therapies. So how this goal has came into the field? This concept of periodontal regeneration was first given by Melcher's hypothesis. So this hypothesis was given in 1976. He was the one who analyzed which type of cells will give periodontal regeneration by analyzing the involvement of various cells during the healing process. So he suggested that when epithelium cell comes into the role, when epithelium comes into the defect or the healing area or after any surgery, then healing happens by long junctional epithelium. And if gingival connective tissue come into the healing area, then healing occurs by connective tissue adhesion and root resorption. This is not needed. Whereas if the bone cells come into the healing area, if the bone cells accumulate in the healing area, then the tooth will become ankylosed. There will be adhesion between the tooth and the bone without any periodontal involvement. So these three, epithelium, connective tissue adhesion and ankylosis, is a totally a reparative process which does not involve the functional activity of the periodontium. So what are these functional activities? It is proprioception and regeneration activities, which involves which will increase the function, masticatory activity of the overall dentition, which is very important for the tooth and gum soft tissue health. So for restoring the periodontium, we need periodontal ligament cells and fibers. For this to happen, progenitor cells has to accumulate in the defect area, which will give the needed cells for enhancing the functional activity. So that is called as new connective tissue attachment, reattachment, new attachment, or periodontal regeneration as given by Melcher. So this is what we are going to gain in periodontal regeneration. So this is the concept which is given by, which is a very important concept given by Melcher for periodontal regeneration. So what is the rationale behind this technique? What are we going to achieve? We are going to involve the process of concept of selective repopulation of cells. So from the definition, we understood the concept of selective repopulation of cells, that is we are going to recruit the cells in an organized way, that is very important. And second is the protection of blood clot, so which is the first phase during healing. If we are protecting the blood clot, it will be the source for future progenitor cells to occupy in the defect area and to give the new tissue. And the third property is space maintenance, so that will be given by the materials we are going to use in regenerative therapy, that is called as guided tissue regenerative therapy, which we are going to use membrane and other additives. So those materials will enhance the space maintenance protocol during a defined period for regenerative or proliferation maturation to happen. For this phase, we need space maintenance. So how we are going to achieve these rationale? By the use of membrane. So membrane is a very important material to be used in guided tissue regeneration rather than the other additives. So membrane should be used with all other additives, or it can be used individually also. So these barrier membranes which is used in guided tissue regeneration have two layers. One is the porous layer, another one is the compact layer. This membrane, when placed onto the periodontal defect or infrabony defects or any other form of guided bone defect, it should be stabilized and adapted over to the defect area, extending beyond the borders. If it is placed in such a way, the facing of the membrane should have two faces. One is the porous layer, which will be faced towards the gum tissue or flap side, and the compact layer will be faced towards the bone side. So this is how this is a very important step which should be maintained in the surgery. The porous layer should be faced towards the flap and compact layer should be faced towards the defect. If this is placed in such a way, we will get a proper regeneration. So what happens if this placement of membrane happens? So if the porous membrane is placed towards the flap, it will do the exclusion of epithelial cells and fibroblasts. So this only is going to prevent the fibrous type of maturation or reparative process, which is not needed for periodontal regeneration. So this is the very important layer. And also the compact layer is going to preserve the blood clot and maintain the space maintenance property. So here where we are going to have the progenitor cells. So this progenitor cells is going to do the role of regeneration by differentiating into fibroblast, osteoblast and cementoblast into the needed tissue. So this is an important step for periodontal regeneration, which is going to achieve the three most important rationale. Moving on to the biological basis of GTR, this biology is depicted as the acronym of PUS. So what is this PUS? The P stands for primary wound closure, A stands for angiogenesis, and S stands for wound stability, and the last S stands for space maintenance. This 4 PAS principle is very important for achieving the periodontal regeneration. We have to remember as a very important point in exam point of view. So this pass is achieved by various steps in periodontal regeneration. So for example, the primary wound closure and the wound stability. This is achieved by the regenerative or flap designs or the surgical techniques we are going to do for the regeneration to happen. So these regenerative techniques starts from the incision design to the suturing protocol. So the incision designs and flap designs should be in such a way that there should be an adequate flap mobilization and proper coverage should be maintained after the material is placed into the defect. So when we place the material, we have to gain a proper coverage via the flap, via the soft tissue. So this is very important for achieving this principle of primary wound closure. And the second one is wound stability. So this is going to be achieved by the proper suturing protocol. So this has to be achieved with the help of ideal selection of suture materials and also the proper selection of suturing technique used. Usually we will go for the sling type of sutures or mattress type of sutures for regenerative techniques, because these are the techniques which is going to distribute the tension and enhance the stability of the wound for regenerative materials to stay and enhance the regeneration. So these are the main two principles which is achieved via the surgical techniques. And the other two things are angiogenesis and space maintenance. So these two things are achieved by the regenerative materials of what materials we are going to use in guided tissue regeneration. So those are the membranes and additives which we are going to select for the patient, as well as the defect based analysis, which is totally depending on the clinician choice and based on the indication criteria. So these four principles are very essential for achieving the periodontal regeneration. So we have to choose the technique, we have to choose the material in such a way that these four principles are satisfied. So coming to the principle or molecular mechanism which will be happening or which we are going to collect during the procedure are, so in order to develop the successfully engineered or successfully regenerated periodontium, we need a properly defined and well-defined signaling patterns and regulatory signaling patterns for recruitment of organized cells for regeneration. And we have to need an abundance of progenitor cells. So this could be achieved by the use of biologics, or we can give an environment, healing environment, such a way that more number of cells will be stayed in the defect area for healing to happen. And the third thing is sufficient blood supply. Angiogenesis is an important protocol. Blood supply is important for the proper healing mechanism. So this blood supply is required from the clot stabilization till the maturation phase. So this is a common area where we have to achieve this by a surgical protocol as well as by the selection of the materials and use of biologics or platelet concentrates, and choosing the appropriate biomaterial scaffold. This scaffold will enhance the space maintenance property or space maintenance property of the guided tissue regenerative therapies. So this can be maintained by the selection of materials with the scaffold mediated choosing of materials. So these are the four molecular mechanisms which should happen when we give a regenerative therapy. So this is the principle behind the tissue engineering concept. Nowadays we are moving on to the tissue engineering concept, where we are using stem cell therapy, scaffold based therapies, with an adequate blood supply, signaling molecules usage, with then protection of the environment from infection. So with these techniques we could achieve a complete regenerated periodontium with a new connective tissue attachment as proposed by Melcher. So this is the principle and rationale behind GTR, why we are using GTR and why should regeneration facilitates the functional activity of the PDL. So what are the surgeries? What are the surgical techniques which we can achieve this guided tissue regeneration? We have reconstructive surgeries which with the use of non-bone graft based associated materials, graft associated materials, and biological mediated materials, which involves the use of enamel matrix derivatives and platelet concentrates and other growth factor based materials. So before going on to the materials which is used or how regenerative therapy happens, we have to understand the concept of GTR versus GBR. So these two procedures, both the procedures are periodontal regenerative procedures, but based on the situations the name differs. So guided tissue regeneration is solely used for periodontal bone defects. It is the treatment used in periodontal bony defects. Here we are going to regain both soft tissue and hard tissue. Whereas in guided bone regeneration, the ultimate aim is to enhance the growth of alveolus, or you are going to regain the bone. So this bony regeneration will be used in peri-implant bone defects or any pre-prosthetic surgeries which is required for prosthetic procedures. So coming to the basic indications or clinical indications of regenerative techniques are 2 to 3 walled infra-bony defects we are going to use in recession defects, furcation defects, or any pre-prosthetic procedures like ridge augmentation or peri-implant bone defects. So these are the ideal indications of periodontal regeneration. And the contraindication, which is not an ideal criteria of this GTR procedures. You cannot achieve periodontal regeneration in all cases. Like for example, furcation involvement, advanced lesions with little bony support or horizontal type of defect or any medical conditions is a contraindication for these regenerative procedures. You cannot regain the bone in such areas. And other surgical related contraindications are any active infection at the surgery, poor oral hygiene, smoking. So these things will alter the blood supply or affect the angiogenic property of the regenerative process. Also the tooth mobility and defect less than 4 mm will affect the membrane stabilization. It will lead to membrane collapse, which will affect the space maintenance property that is required for the guided tissue regeneration. And soft tissue phenotype also plays an important role in periodontal regeneration. We have to have an adequate attached gingiva and adequate gingival thickness in order to regain the primary wound closure, which is being the first step in the principle or biological basis of GTR. So if adequate soft tissue is not there, you are not going to do the regeneration or GTR procedures. So next is the regenerative materials. What regenerative materials you are going to use? So as we discussed earlier, it is the membrane and the additives. So for that usage of membrane, you should have an ideal requirements. What are the ideal requirements? First is the cell exclusion property. So as we discussed earlier, excluding the epithelial and fibrous type of cells is an essential protocol which is going to satisfy the selective cell repopulation process. So this only is going to regain the regeneration rather than reparative process. The second is the framework. The membrane should have a rigid framework in order to be hold in the defect area. It should adapt or hold in the area, defect area, till the healing process occurs, till the regeneration occurs. It should stay in the area. For that, adequate rigidity and framework should be present. And third is the porosity. As we discussed earlier, there is 2 layers, porous layer and the compact layer. The porous layer should have an adequate porosity, or the porous size should be in such a way that it should entrap the epithelial cells and it should favor the needed cells for proliferation. And fourth is the degradation property. So the membrane should not stay prolonged. It should be within the critical period of 4 to 6 weeks. It should stay within the 4 to 6 weeks. So during that period only the wound healing phases is going to happen, which is mainly the proliferation and maturation phase. For stabilization of the membrane, for the membrane to stay, it should be stabilized with the help of mini screws, tacks or sutures within the critical period of 4 to 6 weeks. Okay, and the next property is clinical manageability. So it should have an adequate design in which facilitates the easy handling by the clinician. And the last one is the biocompatibility. The membrane, since it is a foreign material, should not induce any inflammatory or immunological property beyond a certain level. Okay. So what are the materials which is used in guided tissue regeneration or guided bone regeneration? There are 2 type of materials. One is the non-absorbable and absorbable. So non-absorbable material, we have various types like metal, polymer based or combination of polymer and metal based, which is called as reinforced types of materials. One main disadvantage of non-absorbable membrane is it needs a second stage surgery for removal of the membrane after the 4 to 6 weeks of healing period. So we have to take the membrane out after its function. So that requires a second stage surgery, which may not be comfortable for the patient. We are now moving into the era of absorbable membranes. So these absorbable membranes are of various types, which is being natural and synthetic. So these natural membranes are of types of collagen, fibrin, chitosan, cellulose, alginate and amniotic membrane types. One main disadvantage of natural type of membrane is their limited availability and also have a faster degradation time. It will be resolved below 4 weeks also. So that because of these limitations, we are moving into synthetic based materials. So these polymer based resorbable membranes have an excellent property of biocompatibility, clinical manageability and also with an excellent regenerative and rationale of the periodontal regeneration process. So these synthetic membranes are now widely used for guided tissue regeneration. So these membranes are also classified based on generations by Gottlob in 1993. So it is classified as first generation, second generation and third generation. The first generation was non-resorbable membrane, as we discussed earlier. So in these generations, they have given various commercially available materials. So those materials are Gore-Tex, Cytoflex, titanium micro meshes and various nucleopore and rubber dam based materials. In second generation membranes, we have collagen and polymer based materials, which is available in the form of Biomen, Perioguide, Paraguide, Atrisorb, Cologuide, Vicryl mesh, Resolute, Epiguide and various other types of materials or polymer based materials are available, which is enhancing the GTR procedures. Now we also have third generation materials. So this is a modified version of the second generation material, that is the resorbable membrane reinforced with additional materials. So those additional materials are barrier membranes with antimicrobial activity. So any form of antibiotics has been used in the barrier membrane with bioactive materials, which is going to improve the bone cell activity or bone regeneration activity come periodontal ligament regeneration activity. And third one is the barrier membrane with growth factor or any platelet concentrate activity, which is going to use the autologous concentrates. So these membranes, which is modified with the enhanced properties, will achieve the antimicrobial, anti-inflammatory, antioxidant property with regeneration. With the use of membranes, we also know about the additives used. So in that additives, we will discuss about the bone grafts. In bone grafts, we have various types of materials like autogenous, allograft, xenograft, alloplastic materials and growth factors. Autografts are materials which is taken from one location to another in the same individual. Only the location difference, it is taken from the same individual from intraoral or extraoral sites. Allograft are materials which is taken from the different individuals of genetically dissimilar members of the same species. So these are the materials which is taken from cadavers and that is being processed as a mineralized bone graft or demineralized freeze-dried bone graft in order to remove the antigenic component and use it as a bone graft for regeneration. And third one is the xenogenic graft, which is taken from the animal source, usually from the cow and pig, which is called as bovine source or porcine source. And the fourth one is alloplastic material. So these are completely synthetic materials, all polymer based materials, which is available in the form of hydroxyapatite crystals, bioactive calcium phosphate and then polymer based materials. And last, finally, we have growth factors, which is also commercially available, that is being infused with the bone grafts or membranes. So what are these properties of bone grafts? So these bone grafts can achieve 4 principles or 4 properties. The first property is osteogenesis, osteoinduction, osteoconduction and osteopromotion. Osteogenesis is that the bone graft itself will transform into the needed cell, which is the osteoblast in bone regeneration. Whereas osteoinduction is, it will transform the mesenchymal stem cells which is being present in the defect area or healing area into the osteoblast, and it will enhance the regeneration process. Whereas osteoconduction, that is the bone graft is going to just stay in the place and create an environment for space maintenance for other cells to undergo the regeneration activity. That is, it is going to do only the scaffold activity without any osteoinduction or regeneration process. It is just going to maintain the space in that area for other cells to go for the regeneration process. And the fourth one is osteopromotion. So this is a technique where it is going to be achieved by the combination of barrier membrane and bone grafts. So if these two materials are used in a combination, osteopromotion will happen. That is, the membrane will exclude the soft tissue cells from the defect area, and the bone graft is going to do the role of osteogenesis or osteoinduction activity. So this combination of process is called as osteopromotion. So which graft is going to do which property? Osteogenesis will be done by the use of autograft with use of any additional use of biologics. Osteoinduction property will be done by the autograft or allograft, whereas osteoconduction will be happened by the alloplastic materials and xenograft based materials. Osteopromotion is going to be done by the combination of graft and membrane. So these are the bone graft based regeneration which is going to happen in guided tissue regeneration and guided bone regeneration. So these are some of the materials which is used for regeneration. So these are the first one is the xenograft based material which is a animal source, and the second one is the allograft based material which is being processed and commercially available, that is the source from cadaver, that is human source. So recent advances, the future directions, we have membranes which is being incorporated with nanoform based materials, phytochemicals, antimicrobial peptides, any antibiotic or growth factor based material, 3D printed membranes, customized bone grafts. So everything is being now processed and being documented in literatures for their studies and for finding their regenerative properties. And now we also moved into the era of gene therapy and tissue engineering. So in these procedures, we are giving the cells, new cells or stem cells for regeneration to happen, or we are genetically modifying the cells for regeneration to happen in a more natural way for regenerating the lost periodontal structures. So what are the factors which can affect the outcome of these regenerative therapies? So the first will be the patient related factors, surgical related factors which involves defect morphology and surgical related outcomes, and post surgical care. In patients, the main outcomes which that could affect the regenerative therapies will be their systemic health, oral hygiene maintenance, and their post-surgical care, and also their occlusion properties. If the occlusion is not proper, the regeneration will be affected by collapsing of membrane or regenerative materials during the critical period. When based on defect, we have to analyze or select the proper defect for regeneration to happen. So such defects are deep 4 mm infrabony defects, narrow angle defects which will be less than 45 degree, vertical defects, furcation involvement which will fall under grade 1 and grade 2 activities, and adequate soft tissue thickness or periodontal phenotype. So this is only going to give the proper primary wound closure and wound stability. So those defects and those soft tissue protocol should be maintained and should be selected for periodontal regeneration. And third one is surgical related factors. So it should start from incision design to the suturing protocol till the closing of the wound area. So the incision design should be in such a way that it should have an adequate releasing incision for flap mobilization, it should have a minimal trauma, and it should not disturb the blood supply for that healing area. And we also should maintain a sterile environment to prevent infection in that area that is going to affect the regenerative related outcomes. and passive flap tension is maintained by the adequate releasing incision designs which is given during the surgical techniques. So these are the factors which is going to alter the outcome for the success of regeneration. Let's see the step-by-step procedure involved in GTR techniques. The first step starts with the diagnosis and treatment planning. So in this phase, you have to assess the proper periodontal health without any acute infection or acute inflammation. This has to be managed in cause-related therapy, which is called as phase 1 therapy. So after this therapy, we have to find the indication for these regenerative therapies as discussed earlier, and then we should also educate the patient for the needed outcomes and post-surgical care for the patient. So coming to the procedure starts with giving anesthesia to the surgical site and a proper incision and flap design in order to analyze and access the defect and enhance the visibility of the defect. So the incision and flap design should be in such a way that we have to see the defect for filling the area. Okay, the flap reflection should be of full thickness mucoperiosteal flap. So this flap design only will give the accessibility to analyze the defect. And the third step involves debriding the area. We have to remove the granulation tissue, calculus or any endotoxins which is going to be present in the area for visibility of the defect in order to fetch the bone graft materials or membrane into the area. So this is done by the scaling and root planing procedures and root biomodification agents. So after this procedure, we have to select the membrane. So there is no standard criteria for selecting the membrane. You can choose either the resorbable membrane or non-resorbable membrane based on the clinician perception and patient-based selection. So after membrane selection, you have to place the membrane into the defect area. Which can be combined with other additives also. So the membrane placement is very important using with the help of stabilization using mini screws, tacks and surgical sutures. So the membrane should be stayed in the area within the critical period of 4 to 6 weeks. To stay in that area, you have to stabilize the membrane properly, and the membrane should extend beyond the borders of the defect area. So if the membrane stabilization and adaptation has happened, you have to secure the membrane with the help of tack screws and surgical sutures. So after the placement of membrane and additives, you can close the flap. The flap can be closed with the help of releasing incisions or periosteal releasing incisions, and it should be closed with the help of sutures with the proper suturing technique and suturing materials. You can either choose resorbable or non-resorbable material, but the more narrower the diameter of suture material, more minimal the trauma to the tissues in the surgical area, which will favor more healing environment for the regeneration to happen. So these are the general regenerative techniques which is used in periodontal regeneration. So first one is the papilla preservation flap, modified papilla preservation flap or simplified papilla preservation flap technique. Now we have gone into the minimally invasive techniques. So in minimally invasive techniques, we have mist technique and modified mist technique, which involves either double flap approach or single flap approach. And now we also have a soft tissue wall technique, connective tissue wall technique and entire papilla preservation technique. So these are the technique which is going to minimize the trauma to the tissues and enhance the blood supply to the area for ideal periodontal regeneration to happen. So coming to the membrane selection, there is no ideal criteria or standard criteria for selecting the membrane as of now. Numerous studies or literatures are being investigated for selection of membrane or analyzing the properties of the membrane. So as of now, we are selecting the membrane based on some certain factors like bone replacement types, growth hormones and membrane properties. So based on these factors, we can select the membrane for the patient and based on the clinician perspectives. So to conclude, we will address about the advantages and disadvantages of this treatment. The advantages include it is a biologically driven treatment. So this treatment is the fact that science meets art for the treatment of the periodontal disease. So this treatment also has a high success rate if there is a proper selection of cases for regenerative therapy to happen. The limitation of the techniques involved, it is technically sensitive, the cost and availability of the materials also depends, and the risk of infection and membrane exposure totally depends upon the surgical outcomes and patient related outcomes. So periodontal regeneration is it is the employing the use of barrier membranes and use of other additives to guide the cells in such a way that it promotes the tissue regeneration and bone regeneration. The use of barrier membranes in dentistry has grown widely with the use of polymer sciences and nano based technologies and also printing based technologies for reconstructing the lost structures either in periodontium or also in pulpal based tissues. Current researchers are now focusing on the involvement of various functionality of barrier membranes to promote this regeneration process, and now we are understanding the concepts of integration and dynamics of these membranes and the role of other growth factors and stem cells in regenerative therapies, which is going to be an evolution in periodontal regeneration and reconstruction. Well, that's the end of the session today. If you have any questions or doubts, you can feel free to reach out to us. I'll meet you with another interesting topic. Thank you.